Hi, my name is Danae Hudson. I am a licensed clinical psychologist, and I'm also a professor of psychology at Missouri State University. I use Symptom Media in both my undergraduate and my graduate level courses. For my undergraduate courses, I use it in abnormal psychology or psychological disorders. And at the graduate level, we have a PsyD program, and I use it a lot in both my classes on psychopathology and also clinical communication skills. I use Symptom Media in different ways depending on the population. So for my undergraduate students, I really like to use it as a way of showing examples of bringing the psychological disorders to life. So they understand from reading what the symptoms are of, say, social anxiety disorder, but then they can see what that would really look like in a patient. I'm also a practicing clinical psychologist and have my own private practice, so I like to give them examples that I can from my practice, but also it's just so much more valuable, I think, for them to be able to see what it really looks like in another person. And then we have discussions about what kinds of symptoms did you see? What kinds of behavioral observations did you have? Does this seem to fit with what you expected based on your reading of it in the textbook? And it's really just helpful, again, to kind of bring the psychological disorder to life. I also think that it humanizes it for the students as well, so that it's a little bit different than just reading it. Sometimes they might have a stereotypical view of what they think a person with this particular psychological disorder would look like. So I also like to have discussions with them about how is this different than what you expected. For my graduate students, these are doctorate students, and this is their first year in the program. So these videos are really valuable for me to have a lot of different discussions with them, to show them, again, what the disorders look like in real life, but to have a lot of deeper discussions about what are we seeing on the surface, and what kinds of questions the interviewer is asking, and also what kinds of questions aren't they asking that maybe they should be asking, or what are some things under the surface that we need to be mindful of as we're going through this interview and remembering for the future. So I'm using it not just to show them the symptoms of the disorder, but really to help them understand kind of basic clinical communication skills and also the early stages of assessment. How are the patient's answers informing their decisions about what they're going to ask next, and how do they then formulate a case formulation from that, and how would they talk about treatment to this patient given some of the things that this patient has disclosed. So I really find it valuable for my graduate classes in that way. One quick story, I would say this is for my undergraduate abnormal psychology class. Probably my favorite thing to do is when we get to autism spectrum disorders, is to show them the 3 different videos, and the level 1, level 2, and level 3 of autism spectrum disorder, because there is so much misinformation out right now about autism. And one of my goals for that course is to really help students understand what autism is and what it isn't. What does it look like to be autistic, and the severity of that. So to help them to get a sense of the continuum, of the dimensional aspect of autism spectrum disorder, and really how serious those symptoms can be. So I think there's a lot of misinformation on social media about that, and I really want to help clear that up. So we use the Symptom Media videos to be able to show them the differences between level 1, level 2, level 3, and they are very surprised at the severity of that. And so I find that's just a really meaningful experience for them, and hopefully will kind of change the way that they view autism spectrum disorders and see it in a more appropriate way for how it's meant to be characterized. Thanks.